Hi, meet my friend Dr. Parminder Pal Singh, cosmetic dentist and endodontist.
Hi.
I'm here to improve my smile with him. Well, actually, I'm going for a holiday, and when I was looking into the mirror, I felt my teeth are not up to the mark. They were looking so yellow, and I just didn't like it. So I was discussing with sir कि क्या कर सकती हूँ to improve my smile so that I can have my best of the pictures. क्या करें sir?
See, the foremost thing is that जो दांतों का color है, that does not change. So we can make it lighter and better to look at. So the things we can do is we can do scaling and polishing, followed by other procedures which can enhance your smile. Scaling and polishing में होगा कि we can use hand scalers or we can use ultrasonic scalers to clean your teeth, followed by a thorough polishing.
Okay.
The cleaning procedure takes approximately 15 to 20 minutes, followed by the polishing. And in scaling, we remove the plaque, the debris, the calculus, and the stains, the tobacco stains, as well as the coffee stains. It is very essential to get your scaling done if you are a smoker after 3 months, and if you are a non-smoker but a heavy drinker, coffee drinker, within 6 months. Every person is recommended to visit his or her dentist about once in 6 months.
Okay, as a layman, maybe I still don't know much about dentistry. I've heard कि आप बारी बारी स्केलिंग कराते हो तो it makes your teeth weaker. So if there's any correlation.
नहीं, ऐसा कुछ नहीं होता. देखिए, the thing is, I'll give a very crude example. Like if we have a single brick wall, and you take it up to a height of about 10 feet. So if you don't put a plaster on it, it starts shaking. So the same thing happens. The teeth, when you eat, when you chew something, you have carbonated drinks, anything you have, a plaque layer is formed. This plaque layer gets calcified in due course of time and becomes calculus. Now this calculus will act as a plaster. When this calculus acts as a plaster, you feel that your teeth are strong. But once you go to the dentist, he removes this calculus. Because the calculus is just like a rough surface, it tends to push the gingiva down. So when the gingiva goes down, the bone also goes down with it. If the bone goes down with it, the teeth become denuded. They become nude. They become naked. So the crown, which is inside the mouth, tends to increase. And when it increases, because the bone support is short, the teeth start shaking. So it is not because of the scaling. It is just because you kept that plaque and calculus in your mouth for so long, your gums became injured, and that is why your teeth start shaking when you remove this plaque.
Okay. So there's a certain age कि ये particular age के बाद dentist के पास visit करना जरूरी है या scaling कराना जरूरी है?
See, ideally, when we take a textbook, it is written the person should visit the dentist as soon as the first tooth erupts in the mouth.
Okay, I hope we are not too late.
No, you're not. You're not absolutely late. But once the tooth erupts in the oral cavity, the child should be made to visit the dentist once in every 6 months.
Okay. Okay. I keep hearing all this from my patients sometimes कि मेरे दांत बड़े पतले हैं, अच्छे नहीं लगते. ऐसा भी कुछ होता है कोई दांत पतले होना या मोटे होना या उसके लिए हम कुछ हेल्प कर सकते हैं to improve anybody's smile?
देखिए, अगर तो दांत पतले हैं, जॉ बड़ा है, there is spacing, so we can always correct it through braces, aligners.
Okay.
But अगर जॉ ठीक है but दांत पतले हैं and the patient doesn't have time, see, just like कि किसी की शादी है और suddenly she or he realizes कि मेरे दांत जो हैं वो पतले हैं और बीच में spacing है, I want to correct them. So we don't have so much time, like 1.5 years to 2 years, to get the teeth corrected. So what we do is we can always do veneering, or we can always do crown for the person, so that the problem can be rectified immediately, and he or she can get married happily.
And how much time do we need for veneer? Like how many days prior?
See, veneers, we have to just make a very small preparation on the face of the teeth.
Okay.
If the patient or the person does not have much time, we can give temporary composite veneers, which can be changed on lateral.
Okay.
But if the patient has time, and we have time for porcelain veneers, it takes around 7 to 10 days to finish the whole procedure.
Oh, that's great. 7 to 10 days is good enough. You can plan, to the
Definitely.
last moment also.
Definitely.
Because, like when for skin, if we plan pre-bridal, we usually advise the patient you should have at least 5-6 months in hand to
Definitely.
have a good result.
Yeah.
Okay, that's a good idea and a great take-home message for me as well, because I keep coming across such patients when we do pre-bridal glow or such sessions. What to do to improve the smile. अब किसी की crooked smile है, कोई टेढ़े मेढ़े दांत है, उनका क्या कर सकते हैं?
देखिए, we have the crooked smile can be corrected only by two things. Either we can do veneers or crowns or orthodontic treatment. And I have already told you that time span of both the treatments. But if a person has a gummy smile, like when the person smiles, the lip line is high and a lot of gums are shown. The teeth look small as compared to the gums. So we can correct it by certain procedures like we can do a gingivectomy, we can remove a part of gingiva, expose the crown more through laser, or we can use we can do crown lengthening, we can do gingivectomy, we can use Botox, we can use lip augmentation therapy, and we can use fillers also to make the lip prominent so that.
Because when हमारे patients कई बार आते हैं gummy smile से. For that, as a dermatologist, we usually prefer to do Botox or something. But while doing Botox also, I was not very happy with the results of Botox for gummy smile. And once or twice I did came across complications like lip droop. So somehow I'm not very comfortable, and I'm looking for something better than that.
See, gummy smile is a very common problem in Indian population. We can see what gummy smile means is when the person smiles, either the lip line is high or the gingiva is coming more on the teeth. So the proper treatment for this is we can cut this gingiva with the laser. We call it gingivectomy, or we can lengthen the crown by placing veneers, so that when the person laughs or smiles, the proportion of gum to the crown is equal. Then we can do a lip augmentation with fillers so that the lip becomes full and comes down more. Because this usually happens when the person has a thin lip. We can use Botox, as you said rightly, and we can use lip augmentation with the fillers.
Okay. So non-surgical modality even today will be Botox and fillers.
Definitely.
And for the better improvement, or if at all somebody has some abnormality with the gingiva and all, so gingivectomy will be a better option.
Yes.
So anything like post-procedure care is required for all these things?
I'm sorry?
Post-procedure care.
Yeah. Post-procedure care is that when we do the gingivectomy or something, we usually excise 6 or 7 teeth to make the person a person have a better smile. So in this, we give something called as co-pack. It is a zinc oxide eugenol pack which is placed on the teeth, on the gums, so that even if the patient takes hot, cold food or hard food, the gums which are underlying, which are injured or which have been treated, don't get hurt.